Hi everybody, I'm Jordan Bradbury. I'm here to give my perspective about my experience of caring for someone with dementia. My husband Daniel has dementia. He was diagnosed at 30 and he's now 32. He was diagnosed on the 11th of September with early onset Alzheimer's disease. He has a rare gene mutation called PSIN1, and our children have a 50% chance of inheriting that gene. I know everybody's parents' perspectives can be very different, so I'm just going to give you mine, and it'd be really interesting to perhaps talk to you in the break about your experiences. Life before dementia was busy and beautiful. Dan and I have been together for 11 years. We welcomed our twins Lola and Jasper in the world in July of 2016. And we both worked, Dan as a landscape gardener, and I've been working for the NHS for the last 13 years. We were and still try to be your average yet slightly bonkers young family. We planned and saved for the future, a future we now know won't be a reality for us. So, on the day we received a double bombshell, we left the hospital with a leaflet about dementia in hand and a prescription for a drug that would hopefully slow things down. We left the hospital not knowing what dementia is and what to expect. We left the hospital not knowing how much time we had left together. So many questions were broken. Weeks passed, and to be honest, they were a bit of a blur for us. Our families kept us occupied, and of course our children. They were still so small and gave us a focus. We had to be strong for them. I cried a lot, and Dan really didn't talk much. But one thing that he did say that will forever be imprinted on my mind is that the world is done with me, Jordan. I'm no use to anybody. So more weeks passed, and on the 15th of October we were introduced to Chris Short from the Working Age Dementia Clinic. Chris was a welcome relief for Daniel and our family. They hit it off really well, both drummers, similar interests in music, and both bearded gentlemen. Daniel started to talk again. Chris came to help us keep Daniel occupied and to make him feel like he had a purpose again. In the months leading up to Daniel's diagnosis, he had lost his job for underperforming. He'd worked since he was 16 years old, so being unemployed, unable to drive, and living with dementia drove Daniel into depression. Chris helped pull him up from this. He did this by offering different therapies and activities for Daniel. Chris even managed to secure Daniel a supported voluntary gardening placement. Things seemed positive again. But the catch is that this service was and is still only available for 6 weeks after diagnosis. And that's just 6 weeks. 6 weeks to learn as much as you can before being left alone just to manage. Chris saw Dan throughout those 6 weeks, just once a week. He was positive and encouraging, and he cared. Just once a week isn't enough. We were anxious and desperate for more input from Chris. Chris reassured us that he will work with Daniel for as long as he could. It was only in November of 2017 that we were introduced to Lisa, a community psychiatric nurse. Lisa was very open about Daniel being the youngest person with dementia that she'd ever cared for. But the positive Lisa had a passion for working with people diagnosed with dementia and supporting their families. She was informative, honest, whenever we asked her to. There was reassurance we needed, so long-term care and someone who wanted to support us. She cared. The catch again is that Lisa would only be available for 45 minutes a couple of times a month. In January of 2018, after some encouragement from Lisa and our families, Dan and I took the huge step to go public about his condition. Our only hope is to create awareness and to educate others that dementia isn't just an old person's disease. It's not a natural part of ageing. It's a disease and therefore should be cured. We used newspapers and radio and TV. We got the word out there. And in January alone, we helped raise £300,000 for the Alzheimer's Society. We only used 3 hours of our time to do that. We also managed to raise an additional £20,000 for our family's bucket list. People cared. The aftermath of this found us being contacted by hundreds of others who were fighting dementia in their loved ones. Mostly there were messages of support and kindness, and then came the messages of people asking questions and searching for answers that I just simply couldn't give. It became very clear to me that something was horribly wrong here. These people don't know who to turn to, and out of sheer desperation turned to somebody who took the plunge to speak out. It's still clear we are the definition of the family that does not fit, but we were saddened to learn that we weren't the only ones. Dan now requires help from social services. He needs a carer to keep him at home, as Dan and I had wanted and as I had promised him. It's no shock that since Dan has stopped working and that I've dropped to part-time hours, that we heavily rely on benefits to support our family. It was a shock to learn that despite this, we'd still have to top up the hourly rate for the cost of a carer. My husband sadly won't reach retirement age, but if he had and developed dementia, his prescriptions would be free. But instead, as Dan is only 32, we have to pay for a drug that has so far not halted or slowed down Daniel's progression. So here we are, essentially paying for private healthcare without the service and choices you'd expect. It's safe to say that our time with Lisa, Chris, Kate and Dr. Andrews has been welcome, but the time they are allocated for our family just simply isn't enough. Dan's dementia is complex. It isn't 9 to 5, Monday to Friday. Dan's needs are complex and our family's needs are forever evolving. Our children have reached a stage where they are curious and asking questions as to why Daddy isn't around as much. What do I tell our children? Should I tell our children? How do I explain to them that their daddy is dying from dementia? That their daddy has a poorly brain, can't come and play today? Sorry. Who do I contact to help me with this? In other areas of the country and in other NHS trusts, we are aware that there are admiral nurses for dementia who have significantly more time to dedicate to families like ours, whose time is not questioned and do not have to also hold caseloads of 30 plus people of varying mental health illnesses. They are specialised clinicians that have a passion for dementia care and are very skilled within their field of work. It seems from Daniel's experience that we have also fallen victim to the postcode lottery of the NHS. Are the residents of Nottingham and Nottinghamshire County not worthy of such a specialist service? I am determined not to let our children down, so I've taken matters into my own hands. I've had to find a way of explaining things to them. So I've wrote a little book for them, and it reads as so. Our daddy's poorly brain. Our daddy's a giant, so tall, brave and strong. He sometimes forgets things and says our names wrong. Mummy tells us daddy has dementia. This means he has a poorly brain. This is why he loses things over and over again. But there's lots of things that our daddy can do, like sing, dance and paint and play with us too. Our daddy always gives us the warmest of cuddles. He watches us from the window when we are splashing in big muddy puddles. Daddy is tired, but when he is able, he sits with us for a feast at the kitchen table. Sometimes our daddy is away for a while, but he always greets us with the biggest of smiles. We love our daddy and his poorly brain. He may be different, but we love him all the same. Come here today as a wife, a mother and a colleague, and on behalf of the 850,000 people throughout the UK with dementia and their carers. I've come to ask and play if I have to for a review and restructure of the current dementia care system. Daniel's Alzheimer's may be rare, but dementia is not. And as you can see, it is ageless, it does not discriminate. The saddest part is if Daniel had been diagnosed with another illness like cancer, He would have access to free healthcare and medication. He would get financial support and advice for our family, and we would be supported throughout this. But Daniel doesn't have cancer. He doesn't have the hope that his condition could potentially be cured. He doesn't have the hope that his medication will help him. He doesn't have the hope that a cure will be found in time for him or our children. Our family don't get the level of support it needs to keep us all together. And still the fact remains that Daniel is dying. His brain is dying. And we should be spending our last few years of our time together making happy memories for our family and happy moments for Daniel. But instead, we're here trying to speak out in the hope of fixing a service that at the moment just doesn't work or exist. So I'll leave you with this final thought. 1 in 3 people in this room will be diagnosed with some form of dementia. Today, everybody in this room has the ability to make a change. So my question to everybody here is, what are we all going to do about it? Thank you.